Welcome to MRI 152. As soon as you get loaded into MRI 152, you'll want to go over the syllabus, upload your syllabus signature page. You'll also want to watch the bloodborne pathogens video, and then go to the discussion, go down to bloodborne pathogen discussion, and let us know that you have finished watching that video. We want to jump into the MRI 152 clinical notebook. This first link is to the ART page that explains what the requirements are for clinical. The second page is going to be a log for the exams that you perform and the ones that you will be uploading to the ART. This is what you will keep and you will upload to OC Tech, and in the event that you get audited, this will be your backup. All these exams can be performed with assistance, with the exception of the psychomotor objective or checkoff. The clinical attendance form, we'll scroll down to the bottom here. You'll need a new clinical attendance form each month, and please total the hours for that month down at the bottom. Student clinical performance evaluation, or a room eval, needs to be filled out twice during the semester. When you go to your assignments, you'll be able to see the due date for each of those there. The psychomotor objectives, or checkoff, or a comp form is right here. This is the form that will need to be filled out by the technologist that is reviewing you performing the exam. The exam will need to be performed without assistance. What can be performed with assistance is the parameter sheet. Fill this out just with the comp that you are doing, and it's important to know what sequences you're running for a body part and what your parameters are. The QC requirements checklist, you'll want to print this off. Your ACR accredited sites will do this at least once a day or once a week. And when you are able to perform this, and you can do this with assistance, have this filled out, and then get that uploaded in the assignment section, and that will count as one of your 8 comps for this semester. Student expectations. On here, it lets you know that you need at least 2 room evals for the semester. Perform a minimum of 8 psychomotor evaluations, checkoffs, or comps. You'll need 216 hours for the month, and that equates to about 18 hours a week. The ART requires that you complete 125 repetitions for the entirety of the program. You're able to upload up to 6 repetitions. Here it says 3 to 5, but it's because I have not updated this sheet yet. And there's a technologist role for MRI students, and then there's a clinical reminders. The clinical reminders will remind you that you need to make sure that you are on time, dressed appropriately. You do not necessarily need to wear all white. That is not a requirement anymore. Down here toward the bottom, you have your midterm and final exam links here. There's an MRI planning guide that I created as a PowerPoint presentation to kind of give you an idea of areas of coverage for each body part. This is just generic. It will change depending on the protocols that are going to be at the site that you are going to be a student. It provides a quick outline for interacting with patients. It's always important to make sure to acknowledge your patient, acknowledge their family, introduce yourself to them, let them know how long they can expect before they are discharged from the exam. Make sure to explain the exam to them. Let them know they're going to get an IV if there's contrast involved. Let them know that it's loud, they'll get hearing protection, that they will have to lay down, that there's a coil that is involved that will go around part of their body part. And then when you discharge the patient, make sure to tell them thank you. And lastly, we have links down at the bottom, very similar to the links that you saw on the 111 Aunt Minnie is a very good resource. You can go through and check out a case of the day there. That'll help you get used to evaluating the images. MRI Master is also very good at MRI planning, different sequences you can use. MRI Safety is very good for looking up implants. Radiopedia is very good at looking up just general MRI information and questions. And again, if you have any questions for me or need to contact me, my contact information is on the front page of the MRI 152 course. Thank you.